Hello, Chair Gelser, Vice Chair Hurd, and members of the committee. I am Dr. Carol Chervenak. I'm the medical director of ABC House, Child Advocacy Center, and I will probably lapse into saying Child Abuse Intervention Center because I've been saying that for a number of years. And we keep changing our acronym. You can see ABC House in the Mid-Willamette Valley. We serve Lynn County and Benton County. Two of the core components in the assessment area of the child advocacy centers is forensic interviewing and the medical exams. The forensic interviewers are trained to a national standard in alliance with the Oregon Interviewing Guidelines, and they are experts in understanding the developmental needs of the child, how to developmentally appropriately ask those questions so children actually will understand those questions. They ask questions in a culturally appropriate way. And the whole goal of the experts who are the forensic interviewers is to set a stage, a safe place where children can accurately describe what their experiences have been. They ask open-ended questions, they're non-leading questions, and they are trauma-informed. They understand that when a child is jumping up and running around the room, the closer they get to talking about their experiences, they understand that that there are trauma reasons that happens, and they have strategies for dealing with that. This is a lovely chart that gives you an idea of the kind of age-appropriate guidelines for asking questions. Children who are really quite young do pretty well with who questions and what questions, but how questions go right over their head. An interviewer, perhaps someone in the field, a well-meaning DHS or law enforcement person, may not have and usually does not have this kind of training, and they don't understand that something that seems really simple and benign, asking, how did you get that bruise, is way over the head of a 4-year-old. And they will give an answer because they are trained to answer adults, but it may not be an accurate answer. As children get older, their development increases and they can understand more complex questions, and the forensic interviewers are trained to deal with that. Now, here's where I live in the medical exam, and I think the important thing that I would like to communicate is that the area of child abuse medicine has grown exponentially in the last 10 years. Just to give an example, in the 1970s and 80s, there were literally just a few hundred articles having anything to do, in the medical literature, having anything to do with child abuse medicine. Currently, there are well over 50,000 articles, studies, scientific treatises about child abuse and neglect and child maltreatment. It is sadly rarely a subject that is rarely taught in medical schools and residencies unless a medical student or a resident seeks that information out and that training out. When children present to the Child Abuse Intervention Center, we are educated and trained to consider multiple different differential diagnoses and consider lots of different possibilities. So sometimes we are ruling in child abuse and sometimes we are ruling that out. Just recently, I had a pediatrician refer a child to me, single mother, homeless, really struggling. The child had genital bleeding. The pediatrician, who's an excellent pediatrician, was very concerned about sexual abuse. The child came in, and I was able to identify that she had a benign skin condition that can really mimic trauma, and I was able to, there was no disclosure of abuse, and I was able to rule that out. Just very, very recently, I saw a child that had been seen in the ER the previous night. The mother brought the child in because the child had been over at another adult's house, came home with multiple abrasions and bruises. The mother was very concerned, brought the child to the ER. The ER assessed that this was typical for a child of that age who had fallen down. The bruises and the abrasions, when I saw the child the following morning, were petechial, patterned all around the neck, bruises under the chin, patterned slap marks on the back of the thigh, patterned slap marks on the buttock, multiple bruises on the front and the back. So what I know from education in child abuse medicine is that that pattern and the extent of those injuries is clearly inflicted, and the child in the safe setting of the child abuse intervention center, the child advocacy center, was able to tell me details about how an adult had abused that child. So those are just some examples, and the importance of understanding that this child abuse intervention centers are either staffed with or have access to experts in this area. We have served nearly 8,000 children in the last year, most of whom were age 12 and younger.